I think two factors have come together right now. One is that Asian women often have smaller breasts than many other cultures. And at the same time, because of the education that Dr. Rehnquist spoke about, women now know that a breast augmentation usually looks natural. See, I think women were afraid of having breast augmentation in the past because all they knew was the bad and the obvious breast augmentations, the Pamela Anderson. Most normal women didn't want that, and they didn't know until the internet, until the media started covering plastic surgery, that most women that have a breast augmentation, you don't even know. They just look a little better, and they feel a little better about themselves, have more choice about clothing, have more confidence when their clothing is off. It's nothing that's obvious and makes people turn their head around the room. So I think it's the combination of the awareness now that it can look natural with the desire to have a little bit more breast, which has been so profound in Asia.
I think it's important to understand that we all have a responsibility. So do you as media. I mean, I fully understand there's always an interest writing about scary stories, etc., etc. But if we all want to bring up the knowledge, the level of knowledge among women, making them understand that today there are procedures which are very safe, with high quality, not just regarding aesthetics, but also quality of life, not having to stay away from family and work, with good predictability, short and long term. And it's not science fiction, it's being done all over the world today by doctors. So there are a lot of ways to do breast augmentations, but like everything else here in life, there are some that are better. And the only way, once again, I get back to that, what is better? Well, when it comes to how breast looks, that might be philosophy, what's natural and not natural. But when it comes down to numbers, when it comes down to reoperation and complications, that's not philosophy. Those are facts. And unless we reveal them and try to change, because you should be pretty sure that we have high complication rates. Unless that knowledge is as long if that knowledge isn't aware among the women that there are different ways and better ways, it won't change. So you have a big responsibility in this too, trying to share the knowledge that we're trying to pass over to you, but also when you do articles, do good research. Because I'll tell you, women and also men, but mostly of course women, really enjoy reading about this because they want to know. It's one of their favorite subjects today, is cosmetic plastic surgery. And I urge you and I beg you, the interesting stories should not be the disasters, because the thing is, like Dr. Arthur Swift just said, that the good surgery never shows because it's so natural.
I'm in this career in this industry already 27 years, and we have seen so many progress in all of this. Nowadays, beauty is one of the first desire of most people due to maybe many things. Media, always anything you want to sell, you got a pretty girl or to do the advertising. It's always this appeal. And those that have no beauty, they don't feel good. And then that's why more and more people come, because it's predictable. We are so advanced in our techniques nowadays. And then safe with the antibiotic anesthesia, good facilities, very low rate of infection, very low rate of complications. We know how to pre-evaluate our patient. Then it's really a safe procedure. Then we see that the parents already allow the young children go for feel better, because those that don't have beauty, those that feel down, feel low, they even cannot have a good evolution in life. We have case and case stories and stories to tell you about people that say that I feel always nobody because of my big nose or because of this and that. And ladies with short breasts, small breasts, they don't feel confident. Or even after breastfeeding, when shrink down, and always the media films and so appealing for beauty, if you don't feel confident, it's even difficult for the relationship with the couple and so. Then they come, they do, they feel happy, and then they want to do more, the friends see, and they promote. Even the patient itself, they promote something really important.
Okay. Should a surgeon reject? Of course he should. It is, I mean, if, first of all, let's start. If a patient isn't mature enough to have surgery, she should not have surgery. If a patient doesn't have the indication to have surgery, just a desire, she should not have surgery. If a patient comes to my office, young, beautiful, with beautiful breasts, just seeking bigger breasts because it's a desire, I should say no, because there are risks involved. That's my responsibility as an honest, good doctor. That's why I say not every patient should have good surgery. Sometimes the best is the one you don't do.